Hey, you guys, Dr. Nicole here, talking to you today about the differences between a dilator and a wand. Now, this will be a relatively short video. I could go on for 30 minutes on each one of these things. So the best thing to do is make sure that your pelvic floor physical therapist has instructed you in the correct way to perform these type of exercises and or self-care activities for your specific condition. But there are so many times when I see a patient that has been from another pelvic floor physical therapist and they're not quite using the dilators and the wand in the correct fashion. So I'm going to explain the difference between the two and things that I think are the most important to treat for each type of condition with each tool, and then how they can be crossover functions and then how they really can't be. So just to give you the lay of the land for a second, remember we're talking about somebody that has pelvic floor dysfunction that's causing something like pelvic pain. Usually we're using this for some sort of pelvic pain, painful intercourse, sexual pain, something where somebody has told you that your pelvic floor muscles need to get relaxed or massaged out so that we can sort of work out the tissue of your pelvic floor so that your pelvic floor can then be in a more optimal tonal state, right, or more optimal relaxed state in order for your pelvic floor to function better. So things that are common in this area are pelvic floor dysfunction, pelvic floor muscle spasm, and any of the pelvic pain conditions like vulvodynia, vaginismus, penile neuralgia, interstitial cystitis, endometriosis, anytime where your pelvic floor might be a little bit more like, yikes, hypertonic. I think you probably have heard that term before. So a lot of times your pelvic floor physical therapist will do the assessment, and we do have a video on what to expect during your internal exam. And they've usually assessed your internal pelvic floor, and they will say, great, here's some stretches, and here's a way to do self-care on your pelvic floor and sort of mimic what we do in the clinic for pelvic floor relaxation or some of the manual therapy techniques that we use. And so for these areas, a lot of times people will be given the choice or talked to about both dilators and wands. So this is an example of something called a TheraWand. There are couple of different companies that make these type of wands. This in particular is called the TheraWand, and this is a one that uses a little bit bigger. There's one that's even skinnier for people that can't tolerate this type of tip. Or if you're going to be inserting it into your rectum, it's even smaller than this. So, but it's a little bit pointed at the end, and it has a curve, and the curve is really important, and I'm going to show you why. Contrasted by something called a dilator, right? So a dilator, and this is a silicone dilator, which means it's really bendy. There are different dilators that are straight plastic that are just a little bit more rigid, but this is a silicone-based one. And so there are different sizes, right? So this is a set of 4, and right, so it comes in different sizes. So this being the smallest one, right? And then goes up to, this is basically halfway. And so they can get relatively large, right? Those are dilators, okay? If you think about the goal of the dilator, it is to be inserted into the vaginal canal, and then you can, it can help to relax your muscles around the dilator. It can also help if you're having any painful insertion. It can help if you're having any fear or anxiety around insertion. It can help to teach your muscles how to relax around the thing. And so what's really good about it is that there's different sizes, right? So we can start with as little as this one. As soon as you get up to a certain amount, then you would move on to the next size, and so forth and so on. But here's the thing, especially with silicone dilators, these are not, because they're bendy and they're not as long now, right? So now all of a sudden we have this. Then if you try to insert this bendy thing into the vaginal canal and try to push it, it's going to bend, and it's not going to be able to actually press down on any of the walls of your pelvis and pelvic floor. Versus this is a little bit more rigid, and we can actually come in here and actually create a little bit more of a Definitely don't want to say force, but you can give a little bit more pressure, so where you can have a sustained amount of pressure right at whatever pelvic floor muscle that you want to be on. The dilator can't do it with the amount of force because it's bendy, and it's usually not long enough to reach some of the muscles that need to go all the way back here towards your tailbone, right? That's actually a relatively far distance. We're putting the wand in about back here, and it curves, right? Especially for things like your obturator internus, where you're getting here on the side wall. This is a better picture over here, right? Where we're getting in towards the side wall. That curve is what allows you to get over there, right? And these guys don't really do that. And even if you're using a dilator that is more rigid, it can't curve, right? So now all of a sudden you have to really wedge it over, and it really only has one angle that it can push at, versus this guy can actually move and curve to the other areas of your pelvic floor. So one of the biggest things that I see a lot of the times is that somebody has been told they need to use dilators, but what they really needed is some point pressure types of activities that would have been better suited for a wand. And so they're trying to use their dilators as a wand, and it can get really frustrating. And a lot of times you can't reach the area that you need to reach. Conversely, sometimes I'll have someone come in with this, with really painful intercourse, and they're trying to use this as a dilator, which works until it's about the same diameter. And then if whatever you're inserting or your partner is larger than the diameter of this, you can get stuck. So you can relax all you want around this, but we actually need it to be a little bit wider so that we can practice relaxing around something a little bit larger. So then in that case, you're trying to use the wand as a dilator. And so I can understand and appreciate trying to be cost sensitive. These things are not necessarily super cheap all the time, but there are really good options that are relatively affordable. But to me, it's like I want people to be using the correct tool to obtain the correct amount of goals for whatever we're trying to work on. So if you need to do more point pressure types of work that's really been helpful with your pelvic floor physical therapist, then you might want to invest in a wand and save dilators for a different type of goal, right? If you're really having a hard time relaxing around something, or you have a lot of fear and anxiety around insertion, then you're going to want to put your money, time, and effort into dilators, right? But don't try to cross use them necessarily. If you feel like it's not working for you, then it might not be. That might not be your imagination. There are certain instances where you can, especially with the more rigid dilators, you can actually use them for certain depths for certain types of pelvic floor muscles. They actually can reach okay. And if you're one of those lucky ones where your issue of the pelvic floor is actually at the exact depth that the dilator being used as a wand can help, then great. Then that's awesome. And you saved yourself some money. But I really want you guys to understand the difference between those two things and really think about what is your primary goal right now, and then what is maybe the primary goal in the future. So a lot of times, what we'll end up doing is having patients get the wand first, as long as they can tolerate something. And this is for like painful intercourse, if you can actually tolerate some sort of insertion. And then we have them work some of those muscles that we work in the clinic with the wand first, and then progress towards bigger dilators if you're having an issue with some deeper penetration issues and or having a hard time relaxing. Conversely, with somebody like that has vaginismus, this is absolutely not appropriate right away, right? And I might start with some very small, skinny, very bendy dilators, so that we can even just put it right at the opening, and then we can work on getting it closer and closer in. And there's a stop here, which is helpful, right? So you're not going to push it too far in, and we can work on the relaxation phase, progress upwards, progress to this as you get more comfortable, and then use this for the rest of the way. So Sometimes both are needed for optimal sort of pelvic floor self-home care. And sometimes it's just one and sometimes it's just the other. But make sure you are working really closely with your pelvic floor physical therapist on which tool is right for you at which point in your and which phase in your physical therapy, and make sure that that matches your primary goals. So don't be afraid to have that conversation. And it might not be your imagination. If you're trying to use one for the function of the other and it's not working that well, try not to get frustrated at yourself, and you might just need to invest in the opposite tool. I hope that was helpful. It can be a really frustrating thing if you're not getting the correct information. And so if you need any help with any of that or finding a pelvic physical therapist in your area, please reach out. We'd love to help you to do that. Thanks.